When will Medicaid cuts go into effect? June 29, 2025. Breaking news regarding Medicaid cuts has everyone asking, when will these changes actually take place? The recent legislation has stirred up a lot of conversation. Many people are concerned about how these cuts will affect healthcare access. If you are looking for answers, you are in the right place. The Medicaid cuts are part of a larger Senate tax bill passed in 2025. This bill aims to reduce Medicaid provider tax caps from 6% to 3.5% in states that expanded Medicaid. However, the implementation of these cuts is not immediate. The phased implementation is scheduled to begin in 2027. This means that while the legislation was passed on June 29, 2025, the actual reductions will not take effect right away. Key deadlines and regulatory rules will be issued in 2026. The cuts will primarily impact Medicaid provider taxes and rural hospital funding. Rural hospitals are expected to face the most significant financial strain. These facilities relying heavily on Medicaid provider taxes to cover their operating costs. Estimates indicate that by 2031, revenues from these taxes could decline by over 40% for rural hospitals. This is concerning, especially given the proposed $15 billion Rural Stabilization Fund meant to help offset some impacts starting in 2027. The debate surrounding these cuts includes worries about an increase in uninsured individuals. Some lawmakers are opposing the bill due to its Medicaid provisions. They fear that access to health care will be compromised. On the other hand, supporters of the bill argue that these changes will help reduce fraud, waste, and abuse in Medicaid. They believe it will refocus the program on aiding those who genuinely need assistance. In summary, while the Medicaid cuts are linked to legislation active as of June 29, 2025, the actual reductions in funding and provider tax caps will begin in phases starting in 2027. The ongoing impacts will be felt through the early 2030s. Keep an eye on this topic as it continues to develop, especially if you or someone you know relies on Medicaid services.